Doctors of Reddit, what was the most craziest thing you found in a patient? I have a frequent flyer who enjoys systematically inserting needles and straightened out paper clips up his urethra and then coming to the hospital to get them removed. Friend is a nurse on psych ward. Had an old guy who liked shoving AAA batteries in his urethra. Eek! Stupid TV remote's not working. Jim, you got any batteries? Yeah, give me a second. Pops battery out like a PEZ dispenser. Pennies dispenser. Just imagine some guy closing his eyes and looking up at the ceiling and fucking milking the snake, and out pops some AA batteries to horrified look of the guest of THR house. The feeling my entire body just went through reading that and thinking about it was insane. I'm pretty sure my dick packed up and left. I don't know why I also keep looking into threads like these with curious optimism, and eventually there's always someone messing with their eyes or dick, and I'll leave in disgust and an uncomfortable feeling in the affected area. Whole body clench. Yep, and I have a female urethra. Not a doctor, but a former Navy corpsman. I had a patient come in a few weeks after shooting himself in the femur with a nail from a nail gun. He was on the roof and started to lose his balance, and apparently instinctively placed the nail gun on his leg to keep himself upright. He fell off the roof, pulled out the nail with a pair of vice grips, but couldn't get all of it. He thought it wasn't a big deal until one day he was casually walking and his femur snapped in two. I am at a loss for words, and highly impressed. My dad accidentally shot himself in the butt cheek with a nail gun while we were working on a roof. I watched him pull it out with channel locks. I was probably 8 years old. I think I just died a little inside. Did the metal keep the bone from healing or something? Wow. It was a few weeks later. I like to think that the structural integrity of the bone was compromised by the nail. As an intern, I saw a patient with a horrible open abdominal wound that wouldn't heal, and horrible hygiene with no self-care. He came into the ED due to abdominal pain, and we found about 12 maggots buried into and crawling in his large open wound. Only 12? That's rookie numbers. Bruh. Once in the NT rotation, we had a patient with cancer of his jaw that spread and necrosed, and we had to take out 100 to 150 maggots out of his face every single day for about 2 weeks. Had a similar case where a homeless guy's left forearm was infested. Too much cleaning and the smell. Still can't forget the smell. That's the smell of death. I fell and I slipped in the bath and a shampoo bottle went up my arse. No, Steve, it didn't. You saw the head and shoulders bottle and wanted to see if you could add another body part to the product. I was having drinks with an ex and her RN friend. The nurse told us a girl had recently came in with a perfume bottle shoved so far up her ass they had to surgically remove it. Well, at least her farts smelled good for a while. What has the world come to? It was always like that. Never changed. Had a 12-year-old patient come in the ICU with a bullet wound on the frontal part of the head. Pink brain material was oozing out of the bullet hole and out of the nose. For a reference, I was doing medical practice in a relatively small hospital in Guatemala. A pretty dangerous city because of drug trafficking and all. From the little story bits we could gather, the kid was just playing alongside a nearby river when he suddenly collapsed on the rocks nearby. His grandfather was nearby and was the one who brought him into the hospital. The story suggests that a stray bullet was the one that hit him. The grandfather's story suggests that he heard shooting on the other side of the river, but didn't pay much attention to it because it's common for people to carry guns around and sometimes just randomly shoot in the air. Unfortunately enough for the child, the bullet hit him straight in the head. We had imaging done on the child, and once we got to the head, we saw that his brain was practically turned into mush with the bullet still inside. We tried everything we could, but he ended up passing away a few hours after. My condolences go towards the family and RIP to the little boy, but how are you mentally after seeing the 12-year-old boy like that? You see stuff like that on a regular basis. You kinda get used to it. Unfortunately, though, those are moments and emotions you tend to bottle up and never express or let out. I've had similar cases, but you learn to accept it as it is and just move on. You have other patients to look after. You know? As for me, mentally, I'm doing fairly okay. Please like and subscribe for more daily content.